Apologies for not having done a mobility for a long time. I did CHAD, which was 1,000 step-ups, and it absolutely broke my body, and I was in no state to be able to demonstrate any mobility whatsoever. Anyway, back on it now. So today we're going to do is probably ankles and knees and a little bit of hips, but it's more focused on the joints than it is necessarily the muscle, although we are doing some muscle stretches at the same time because they do limit the amount of mobility that you might have. So you don't need any equipment, and I'm just sitting on a chair, although you could use anything that you can that you have to hand. So everything that we do, we're going to do 10 of, and we're going to start by just holding your knee up, and it's only really to get your foot off the floor, so it doesn't necessarily have to be up this high. So what we're going to do is ankle circles, and they're not necessarily fast. What you need to think about is bringing your toe up towards your knee to its furthest point, and then taking your foot in, pointing your foot as far as you can, and then turning your foot to the outside. So it's just 5 circles in one direction and 5 in the other. Although if you've got really stiff ankles, you can do many more of these. So but they're nice and slow and really deliberate. So don't be just wanging them around in a circle, because you want to get to full end of range in each direction. So pointing as far as you can, turning your foot out as far as you can, bringing it up towards your shin, and moving around in a circle very deliberately. So what this does, rather than necessarily stretching a muscle, it's mobilising the actual joint at your ankle here. So for those of you whose heels come off when you're squatting, this could be a problem. And for those of you who have sore ankles. So we're doing 5 in each direction on each leg. So I'll just turn around so you can see. What was I going to say? So when we move a joint in its full movement, the joint lining releases something called synovial fluid, and it's a bit like oiling the engine of a car. If we don't move it very much, then the joint doesn't get much oil. So the more we move it and squeeze the joint capsule in all directions, the more lubricated your joint actually is. And you might find that you're really juddery in the movements. That doesn't make any difference. It's just about motor control of your ankle, really. So we're going, I don't know how many I've done here, but we're looking at kind of 5 in one direction and 5 in the other. And again, just make sure they're nice and slow. I'm sure you will have done something from those. So now we're going to stand. You can hold a chair if you want to. So what you're going to do is, this is more for your toe, the joints. So you are bending your ankle to as much as you possibly can, and then rocking it forward and bending your toes. So you're rocking back and standing. So into your ankle, into your toes, rocking back. So in this position we're stretching your Achilles and also stretching your calf muscles, but we're also stretching your toe joints, which doesn't seem very important unless you're a runner or unless you get plantar fasciitis, which is pain on the bottom of your foot, in the arch of your foot. So it's just ankle movement, then toe movement with your ankle in a bent position. And some of you might feel a stretch on the inside of your sole, which shows that you're doing the right thing. So, rocking through each foot. I don't know whether that was 10 or not. So, into your ankle. You might not be able to get as full a flexion as this, or you might be able to get more for all I know. So, dropping in, lifting, down and up. So you can try and keep as much flexion in your ankle as you can when you rock up onto your toes. And you might be like me, just get a nice big fat click out of your ankle. So over these movements are all forward and backwards. So the next movement will be more about rocking your ankles and getting sideways movement, which we don't do much of. So all of these things are safe for everybody to do. But on the next one, if you've recently sprained your ankle in any way, then possibly don't do this. I don't know how I managed to find the squeaky floorboard in the room. So all you're going to do is go into a slight squat and you're, gosh, big crit from side to side. So all you're doing is lifting up the inside of this foot and the outside of that one. So you're lifting up each side of your foot and rocking your feet from side to side, just to give some sideways or lateral movement to your ankles. And this just mobilises and keeps your ankles nice and fluid. And as I say, if your heels come off in a squat, then this is an important one for you to do. So your body is staying completely still, and the movement from your knees and your hips is just by the movement of lifting your little toe on one side and your big toe on the other. So little toe and big toe on opposite feet, get that movement. So just to get, done this before, so just to get a little bit of movement in the other muscle in your calf, you're going to kneel, your foot is mid-calf, mid-calf shin of this leg, and all you're going to do is drop in to the front foot. So it doesn't matter if your heel comes off slightly. But the aim is, as you rock forward, to pop your body weight on your front knee here, and you'll feel the stretch in the lower part of your calf here. So this is a good muscle, a good exercise to do if you're planning to go off running as well, because it mobilises and stretches your Achilles, the stringy bit at the back of your ankle here. So you're just rocking from one leg to the other, and other leg the same. So foot next to the middle of your shin, and it's amazing the difference that you can feel between one leg and the other. So this is the leg that appeared to take most of the strain after doing Chad, and it feels absolutely horrible when I'm doing this. Okay, so this is soleus stretch, which is the deeper muscle of your two calf muscles, and it's the one we're least likely to stretch. So 10 or so of those on each leg. Then we're going to go from a hamstring stretch to a calf stretch. So stepping forward, actually do it on this leg first. So you want to make sure when you step forward that your toes are facing forward, not that you've dropped your heel out to the side here. So you want your toes to be facing forward, and you're just going to drop down into the front leg, which will put a stretch on your back leg, and then just rock, too far forward. So in this position, and then rock backwards, lift your heel, drop your back, your chest to your thigh. So you're going from a gastrocnemius stretch or a calf muscle stretch, and dropping back into a hamstring stretch. So when you go forward, make sure your toes are facing forwards, try and keep your heel down, dropping your weight into your front leg. When you drop back, you can keep your toe pointed, your heel, you can keep your toe down, or you can pull it up if you want to. Try and keep this leg straight. Don't round your back off as you drop into this, because you won't feel the stretch. You just want to have a nice flat back. So forward, calf stretch, backwards, hamstring stretch. So we're just going to go from one leg to the other. If you do have sciatica, if you lift your toe up slightly, it does stretch your sciatic nerve and flosses it, so releases your sciatic nerve to some extent. But be careful if your sciatica is from a protruding disc. So, I'm doing the same leg. So calf and hamstring. So the most important thing to remember is your toes must be forward and your heel down, flat back. So we're doing 10 of those. I don't know whether we have or not, but that will do for now. So back on the chair. So these are knee mobility. So we've been going backwards and forwards on your knees, so that's been doing some forward and backwards movement. This is rotation, and it's not always clear that knees rotate. So what you're going to do is hold your elbow under your knee, and you're going to turn your foot in and out. So in and out. So you don't want the movement to be coming from your hip, you want it to be coming from your knee here. So you might find you've got very little movement, but otherwise just turning out and in really frees up your knee, and it also releases the synovial fluid that I was talking about earlier. So this is good for arthritic knees, frees them up nicely, and as I say, synovial fluid kind of oils them. So you're looking at 10 on each side. So what you don't want to be doing when you're doing this is turning your leg from side to side. You just want to keep your hip stationary, and the only thing that should be moving is your foot. Although moving your foot actually moves the bones, which are about here, just below your kneecap. So we're doing 10 of those in each direction. And then we're going to do a similar sort of thing, I think we've done this before, for your hips. So you can hold on to a chair if you want to. So what you're going to do, I don't know how to hold it so you can see. So you're going to bring your hip up, take it out to the side, take it behind, and back down. So it's like a bigger circle as you can manage with your hip. So you might feel a stretch in all sorts of directions in your hip, depends how tight you are, but these just keep the joint moving. So it's trying to get the fullest range of movement out of the hip. So you can do 5 in one direction and 5 in the other. That wasn't a very good one. So back, out, up and down. Back, out, round and down. And you might be like me, hear all sorts of cracks and groans as you do it. This frees up your lower back as well, so if you've got lumbar back problems, this can also help. So other leg. So 5 in one direction. I think this is the 5th one. And back down. And round. And last one. And that's what we're going to do for your hips. So we're going to do a piriformis stretch on the chair. So what you're wanting to do is put the side of your foot on the chair and just drop yourself forward as far as you can with a nice flat back. So the nearer you are to making a right angle with this leg here, the bigger the stretch will be. But try to make sure that you're dropping forward with a flat back. Doing a rounded back doesn't make any difference. So all you're going to do is move into that position until you feel it in the cheek of the bottom of the leg that's on the chair. And just hold it for 30 seconds, then you can take a nice deep breath in, 15 seconds, sorry. Take a nice deep breath in, and as you breathe out, just drop into the stretch a little bit more. And ultimately you'll be holding it for 30 seconds. Change legs. So, nice flat back. And just drop into your hip as far as you can. After 15 seconds, take a nice deep breath in, and as you breathe out, just drop your chest towards your calf and hold for 30 seconds. My imagination of how long time takes to go is probably a bit off sync, so probably stayed about 10 seconds when it's supposed to be 30. So the next stretch is called a count stretch. I'll do it from the side so you can see it. So, you're going to put your foot on the chair here. So the nearer your knee is towards the actual chair, the bigger the stretch will be. But your aim is to have a nice line up from your knee, through your hip, to your shoulder. So you're going to move forward and push your glutes towards, or squeeze your glutes and push your glutes forward, and then move back, which moves it more into your into the quad. So if you're up higher, the stretch will be in the middle here. When you drop down, it moves more into your hip flexor. So it goes from quad to hip flexor. But you do have to make sure that you squeeze your glutes and tilt your pelvis forward as you move from one place to the other. So you're just going to rock backwards and forwards. Make sure you squeeze your glutes as you drop forward. Nice rhythmical breathing will also help. And you might feel this stretch right down to your knee. Most people will probably feel it in the middle of their thigh. So just a couple more stretches to go. So 10 on that side, don't have me on, and change legs. So nice and high, glutes squeezed in, tummy held in, and in the upright position. And then just squeeze your glutes, tuck your pelvis under, and you'll feel it more in your hip flexor. Move back, and it will be into your quads. So, nice rhythmical breathing. Breathe out as you drop forward. Breathe in as you move back. And remember, the nearer your knee is, the bigger the stretch. If you struggle in this position, just come slightly forward and the stretch won't be so intense. And then my toes are going to come off the chair. Anyway, 10 of those. Then we're going to do an adductor stretch. So, and we'll probably need to do this on the side. How can I show you this? So, from the side, we are standing with your foot on the chair and your toes pointing up to the ceiling. But I'll just show you the side position. So you're pushing your bottom backwards and standing up. So bottom backwards and standing up. So, and from the front, Your toes are up to the side, so the stretch is down the inside of your thigh here. So as you push your bottom back, you'll feel more of a stretch up the inside of your thigh. So if your foot is turned down, you won't necessarily feel it so strongly. So if you can keep your foot up, it gives you a better stretch. And this is just on the adductors on the inside of your thigh. So breathe out as you drop forward, and as you stand up, inhale again. Exhale and inhale. So remember, you're not just bending forward, you're pushing your backside back to make sure that you get that stretch on the inside. And on the other side as well. So foot up to the ceiling. You don't know how to pray. Don't know why I'm doing that. So breathe out and breathe in. And then the last one that we're going to, so this is, I think, number 8. And then the last one we're going to do is just a held stretch, which is on your glute medius. So that's a muscle that goes from your hip bone on the outside here up to the outside. It also stretches your tensor fasciae lata, or TFL, which is the running muscle at the front here. So what you're going to do is your weight is on your front leg, and you're just going to put your hand behind your head, and I don't feel as I'm doing this right, that's better. So your weight is on your back leg, and this leg is just for balance. And what you're doing is pushing your hip away. To increase the stretch, you can just put your hand behind your head. So, and you might feel it all the way up the side of your body. It depends how tight you are. You might even feel it in your lats. So try and keep a nice upright position and push in to this hip. And on to the opposite side. So weight on the back leg, this leg's here for balance, and you're just pushing into that hip. To create a bigger stretch, you're just going to pull up and drive your elbow up towards the ceiling, and just hold it there for 30 seconds. As with all the other stretches, after 15 seconds you can take a nice deep breath in, and as you breathe out, just drop into it a bit more. Okay, so that was just a mobility for our ankles, knees and hips, with some muscle stretches in between as well. Hope you're staying safe. Thank you very much.